when I do this kind of presenting, I try to make it a bit more kind of interactive, so I might be asking for a bit of participation from you guys at different points. Also, as I'm going through and talking about different things, if you're completely like, what are you talking about, please put up your hand and ask, or if there's questions that come up for you, there's some time at the end or during, throughout, there's absolutely no problem with that at all. Does anybody kind of know what a clinical psychologist is or does? Or are you all kind of like, wow, rough idea? Yeah, we're a bit of an enigma for some people. We're not psychiatrists, so I'm not medically trained. I don't prescribe any medications. We work in a kind of scientist practitioner model, so we look at what's going on out there in terms of the research base, and then we try and apply that in terms of our clinical practice to improve outcomes for people. And Ben was talking about Turning Point coming into Suffolk. I guess what we're going to be doing within that service is trying to apply some more of that psychological evidence base into drug and alcohol work. Thinking about what are kind of mental health problems and what is substance misuse is really difficult. Services really struggle with this. You know, what actually constitutes a mental health problem? What actually constitutes a substance misuse difficulty? And then when does it become dual diagnosis? Like, what does dual diagnosis really mean? So I want to ask you guys, could you put your hands up if you've ever been in a situation where you felt very stressed? I'm trying to see if there's anybody who hasn't. Okay, keep your hands up, keep your hands up. Keep them up, you're still stressed, when you've been very stressed, at the end of the day, you sort of come back and then possibly had a glass of some kind of alcoholic beverage. Yeah? Yeah? And I just want you to think about some of the reasons why you may have done so. You don't have to hold your hands up anymore. I was travelling to Ipswich on the train yesterday, went through London, and there were severe delays on the underground. As soon as I got into the hotel, I went to go and have some dinner because I was late, and had a pint as well. And it's kind of obvious, it makes sense to us why we do this. You kind of know that taking some kind of substance is going to help in some way with your stress levels. And people have been doing this for, you know, hundreds and hundreds of years in different ways. Let's think about the other way around, I guess, as well. Who's kind of been to a social event and seen somebody who, I'm going to say about it kind of being somebody else rather than thinking about yourself, but who's possibly had a bit too much, and they tend to kind of generate these delusions about probably being the best dancer in the world, the funniest person, or the most attractive person in the room. You know, they might be seen double, or slurring a bit. Actually, you know, it's funny, but you know, I guess this could be the basis for starting to develop some kind of mental health difficulties. You know, these are the kinds of symptoms that we would see in people who are really struggling in terms of their mental health. And if you kind of think about that being, if it was something that somebody continued to engage with over a long period of time, those kinds of symptoms might then kind of continue on when the substance isn't present. So I hope what you're seeing is that actually we all kind of fit on a spectrum. You know, over here we might have the people who are coming home after a stressful day of work and having a drink, while out at a party and using whatever substance it might be, and then having some kind of odd experiences. All the way up to the other end of the spectrum where people are really finding it really hard to function. You know, what we would consider dual diagnosis. Some of our service users that require kind of professional input from two different services. And I hope that you kind of hold this in your minds throughout today and kind of going forward, that actually we're all on this same spectrum, and that everybody can be affected by this. Yes. Any questions about that? All makes sense? Yeah? Great. Okay, so we're going to think about some of the prevalence rates. In terms of dual diagnosis, the way that they describe it is that it's a severe and enduring mental health problem. So that's something that persists over time and is such a problem that it really interferes with somebody's life. In terms of substance misuse, it's a similar kind of idea. It's the degree to which the substance use impacts on somebody's lifestyle, whether it's becoming particularly risky. So This is some stats on it from the Mind website. If you go into any of the other outcome measures for or estimates for dual diagnosis, you're going to see varying statistics on this, you know, and most likely the ones that we're seeing are real underestimates of what the actual issue is. So from the Mind website, they were estimating around 30 to 50% of people within mental health with mental health disorders also use substances in a problematic way. And conversely, they're estimating 50 to 66% of people with substance misuse problems also experience difficulty with their mental health. Are these stats surprising? Yeah? Surprising they're so low? Yeah. Actually, you could probably see that at different points within everybody's life, we may have experienced some kind of mental health difficulty. I think it's like 1 in 4 experience some mental health difficulty to the extent of it being severe enough. And then you can kind of also think about the prevalence rates for substance use is very high in society too. And I guess it's the consensus that people with both of these difficulties are not well served by our mental health services and substance misuse services. We don't tend to have services that are commissioned to address both issues. We have kind of 2 separate services, and what happens for clients who experience both difficulties, they tend to kind of fall between the gaps. And we'll talk about that in a bit. So I'm assuming everybody's heard of this thing before, what came first, or the egg, this kind of conundrum. Mental health services and substance misuse services get caught up, or have historically been caught up, in this conundrum for a long, long time. They became very fixated on whether substance misuse problems started first, or whether that should be the primary mode of treatment, or whether the mental health difficulty started first, and whether that should be the primary mode of treatment. I guess for what we kind of know going forward and looking at this treatment population, is that actually it doesn't matter. It does not matter. What's important is how we address those difficulties that somebody is presenting with at present. And what we know is that the best way to do so is to treat both problems at the same time. Incidentally, does anybody know what the answer to this conundrum is? Yes, yeah, excellent round, way longer than chickens. Okay, so how do mental health problems develop? I'm going to talk about a model in a bit. You may have come across it before. It's a stress vulnerability model. Hands up who's seen this before? Yeah? It's old hat, what was it, 1977? I quite like this model in terms of being a clinician because it helps to explain quite simply what might be going on. It helps us to kind of make a very complex issue more understandable for not only ourselves but also for clients and carers. So this is basically looking at 2 axes. Is it the red one looking at the dot? Oh, great. Okay, so you can see I put on this axis here that we're looking at life stresses. Right down at the bottom here is kind of low, and up here is high. Down the bottom here we have vulnerability. And when we're talking about vulnerability, this is kind of about personal resilience. And that can kind of be attributed to a range of factors. Your temperament, the kind of social support you have around you, your housing, your age, your gender, your schooling, your socioeconomic status, all contribute to this idea of resilience, and on the flip side, vulnerability. So we've got vulnerability here, low and high. So why do people use drugs? It's a commonly held wisdom that different substances can help us reduce our anxiety levels. And here's some lovely research graphs that I've managed to pull off. That looking at different medication, public attitudes to different medication use. And here under depression, what's kind of I quite like this because we deal quite a bit with depression and anxiety, psychologist bread and butter, is, people tend to estimate that successfully treating depression with medication, isn't too great for depression. But actually for anxiety, people kind of predict that it's going to be really, really high. We kind of anticipate that taking a substance is going to do a lot for our anxiety levels. And, well, yeah, great, that's really nice to see in terms of thinking about therapy being something. Also, I could say that about therapy, wouldn't I, as a psychologist. So, I guess what this is showing us is that we tend to think about using different substances to help with our anxiety levels quite a bit. And I wonder whether you guys have had the experience when you've been taking medication prescribed by your GP, or perhaps going to the pharmacist, of perhaps not taking it in the way that it's supposed to have been. You might take an extra tablet, or possibly not take all the tablets, or possibly take another tablet alongside the other tablet, like paracetamol and ibuprofen. We've had these experiences. We're not terribly good at sticking to the rules, and we kind of think we know best. Yeah? Actually, this is something which basically people with substance misuse difficulties have been doing, and possibly quite successfully for some time. And the reason why heroin use is so high is because it's very effective at what it does. As is alcohol, kind of know that you're going to have that when you have that pint, it's going to help with de-stressing at the end of the day. Again, thinking about, actually this is just on a kind of spectrum of coping, that we're all kind of on this line somewhere. And similarly, people kind of expect, and I guess it's fairly true, that using substances in the short term really helps with managing those kind of direct mental health difficulties that people experience. Using drugs in the short term manages to kind of push down the stress levels. It physiologically does stuff to our bodies. If you using alcohol, it's a depressant. It will slow your heart rate, kind of dampens down the nervous system, as with similar with other substances like opiates, heroin, that kind of thing. Dampens down our kind of nervous system. It kind of makes us more relaxed. So this is why we can see that actually drug use can be helpful about kind of keeping us in a well space in that interim, in that kind of moment. Yeah, and that's why I guess that's one of the main reasons why people use them. Again, you might be thinking, yeah, but there's other circumstances in which people might use substances. In one of the psychological models that I favour using, which is acceptance and commitment therapy, we talk a lot about strategies being workable or unworkable. And I guess thinking about using substances in the short term, it's kind of workable for short-term difficulties. It's no problem to have a pint if you've had a bit of a difficult journey on the train. It's over-reliance on this way of coping that then becomes unworkable. Okay, and we see this here. So, whereas drug use at one point was helpful in the kind of short term, over time, if you keep doing it, it increases vulnerability. And we can think about all the reasons why that might be. So why might substance use increase vulnerability?
Costs a lot of money.
Yeah. So you have to spend quite a bit of money to do so. Yeah. Yeah, affects your physical well-being. So maybe feeling ill, maybe waking up in the mornings with withdrawal symptoms or something. Somebody else up here? Yeah, sleeping. Yeah. Can interfere with sleep. That's a huge one, isn't it? Diet, yeah. So if you're not eating well, that's going to really erode your coping.
So skew your perceptions, so you might find yourself in risky or vulnerable situations.
Yes. Yeah. So your ability to kind of think clearly in situations might be affected. That might increase your vulnerability. Yeah. And actually feeling anxious about those feeling states. So we'll do what they can to avoid them. And you might see this with some people in terms of not standing up for themselves, or really struggling if they experience a loss or a grief. So what do people tend to do? Well, nobody likes to feel bad, do they? But actually then they would tend to avoid the feeling for example, through drug use. And we know that this works in the short term. You know, it's workable in the short term. Feel the sense of momentary relief. And actually what it does, you know, it's kind of like, oh, this seems okay, but in the long term, this comes back to the issue that you were just saying about, is that it decreases the person's confidence in coping with future anxiety-inducing situations. So you're kind of training your brain to jump onto the strategy that you know worked last time, and that might be kind of having a spliff or having a drink or taking a hit of something. And when the anxiety-inducing situation comes up again, people tend to feel less confident with their ability to cope. They feel less resilient. They feel less able to cope, and you get kind of caught in this quite vicious cycle that goes round and round and round and erodes somebody's resilience. The problem with clients who experience dual diagnosis problems is that they're getting a double dose of stigma. I know we talked about stigma before, didn't we? And it's not, I guess it's, you know, if you've got a mental health problem, you're going to experience stigma in society. Anyway, if you've got a substance misuse problem, you're going to experience stigma. But it's this kind of double whammy that clients with two difficulties experience. And the trouble is with our services is that we're not terribly good at communicating with each other, and there's a confidence issue on the part of the workers in the other services as well. So mental health service staff feel unskilled in managing substance misuse. And there's often as a psychologist, I hear quite a lot about, well, someone's too intoxicated or using too much to be able to benefit from psychological therapy. I'll come on to talking about why that's not true in a moment. And substance misuse staff feel unskilled in managing mental health difficulties. So this is kind of thinking about somebody being too unwell to do anything about their substance misuse. Often I get caught into conversations with people in my service about, well, if we reduce the methadone prescription, which is a substitute opiate prescription for you know, helping people get off of heroin, for example, saying if we reduce that, it will make the mental health issue kind of shoot up, and we can't kind of go there. So there's a real anxiety in services about addressing these issues. And of course, general societal attitudes towards mental health and substance misuse as well. That makes it difficult for our clients to access work, to socialise with people who may not have mental health or substance misuse problems. You know, it's fairly well ingrained in our society, and it's very difficult. And it's just really encouraging to see some of the work that you guys are doing here in Suffolk to kind of raise awareness and get people involved. And it's brilliant. Yeah. So there's a kind of a reluctance to engage with some of this work from different workers. And I wonder whether it comes from a place of feeling unsure and wanting to make sure that the work that you're doing is of the best quality that you can, you know, we like to be able to be helpful, right, in services. We want to see people do well. And actually what this might be about is feeling anxious about it not being 100%. You know, actually for some of our dual diagnosis clients, I guess as you were saying earlier, some may very well not recover, or they may still struggle even though they've got both services involved. What can be helpful from having both services involved is to reduce some of the risks, some of the harm that can be caused by continuing to use substances whilst experiencing mental health difficulty. And I guess my message would be to people working in this field is to think about kind of growing your competence and finding out, you know, for example, if you're unsure about mental health difficulties, to have a little look, you know, see what's out there, see what kind of things you could do in terms of growing your own competence. And vice versa, I suppose. It would be, you know, thinking about, well, what kind of substance, how do substances affect people? What does the latest research say about what's useful in terms of helping people to overcome substance dependence? So, come to the first point up here about feel the fear and do it together. You that actually, working with this client group can be really frustrating, can be really risky. Tends to be the client group that I would spend most time looking at as a psychologist in the substance misuse field. Obviously, my interest is in mental health, but I'm situated within a substance misuse service, so I pay quite a lot of attention to this client group. And I guess what I see is that it's again surprising how much progress somebody can make, even if it seems on the surface of it as if it's miles away. Clients always tend to do that. This work is never dull, and actually I think recovery is possible. You've got to kind of hold that stance for everybody that comes in through the door. And I've got up here about there's no contraindications, a bit of a wordy word, for psychological therapy for various mental health disorders and substance misuse. So if ever you hear people kind of saying you can't provide psychological therapy for somebody who's actively using substances, that isn't borne out in the research evidence. Nice guidance is that people can still access psychological therapy, is still useful for them, even if they are using. The rule of thumb that I take is that if somebody can't actually be present with me in the room, then maybe it wouldn't be appropriate at that time. But generally speaking, it's useful for somebody to engage in that kind of work. So, for example, if you have somebody who's experiencing very difficult depression and drinking at the same time, it would still be useful to, I think it provides cognitive behavioural therapy as the frontline treatment for depression alongside antidepressants. So kind of hold that in your head when it comes up, when you kind of think about people kind of saying like, no, they can't access psychological therapy. It's not borne out in the research. And I suppose as our services struggle so hard to work together, it's about kind of setting those initial conditions to address dual diagnosis earlier on. The earlier that we get to it, the more successful we can be. Because I guess if you're thinking about it being this kind of vicious cycle, the more times that somebody kind of goes around it, the more entrenched, the more vulnerable somebody's going to become. And actually, we see this with working with psychosis, for example, that getting in early is really helpful. Helping people in the earliest stages, and even preventative stages if we can, improves outcomes for people. And I've got down there about improving communication. I think forums like today's are really helpful in terms of bringing mental health services and substance misuse services together with families and carers and service users to help communicate about some of this stuff, because this is the crux of some of the problem, that we don't talk very well with one another, and we don't understand the positions too well. And this forms the basis of what we're doing in Somerset with our dual diagnosis pathways. We're very, very keen to get all of the stakeholders present in one room, and we've got one coming up, I think. Our first one is going to be next month, which we're really looking forward to, because again we know that it's just really about kind of knowing somebody on the other side of the table and being able to kind of know their name and pick up the phone and be able to talk to them. Yeah. Okay. So thinking about building resilience, we'll come back to the high risk situations. Looking at this graph, where might we be thinking that the two biggest things that we might need to be thinking about in terms of building resilience? Yes, yep, spot on. So managing emotions, number one. What's number two?
Getting new friends.
Yes, getting new friends. Social support, right? And isn't this what we've been talking about throughout most of the day? Not just social support for our clients and carers, but also for us as workers. Social support from other services. And in terms of managing negative emotional states, there's some lovely research that has been done by, I'm going to forget the name now. I think it's Jameson, Nook and Mendes in 2012 that's talking about our reactions to our stress response. You can find this on a lovely TED talk by Kelly McGonigal, who's a psychologist who does it probably much better than I will. But this is a summary of what they're talking about. They've done some interesting research in America stating that basically believing stress is bad for your health makes it more likely that it will be damaging. And this is because when we're under stress and believe that it's stressful, our blood vessels constrict and can be more damaging. In studies where people are trained to see their stress as helpful, it's actually seeing the stress response as something that's being useful to you, the blood vessels expand, similar to experiencing joy or courage. And again, this isn't kind of saying like, oh, stress is really good, you should really enjoy it, but actually it might be about trying to reassess, rethink your stress response, so it's not the worst thing in the world. What kind of situations might you be experiencing high levels of stress and it'd be useful for you? So what? Sorry.
At work.
At work, yeah. So why might stress be useful in work?
Because the levels help you keep going.
Yeah. So it might G you up to get going. Yeah. Keep going with work. Other situations? With clients. Deadlines. Oh yes. Sorry. Yeah. So when you're meeting deadlines, kind of getting the energy to get up and meet your deadline, certainly. Examinations. Yeah. We've got some of them coming up. So we've got some students in the room, right? Yeah. So this will be useful for when you're thinking about your exams and studying and everything else. I think about other stuff like dating, a job interview. These are kind of quite stressful events, right? But actually, some of this stuff could be really useful for you. So it's a very simple cognitive reframe. To rethink the stress response as helpful, you just need to be telling yourself the following. Just think about that pounding heart. It's preparing you for action. Breathing faster, no problem. It's getting more oxygen to your brain so that you're ready and prepared. Energized, this is your body preparing you to meet this challenge. It might seem a bit like, oh, this sounds a bit daft. But actually this does have an impact on opening up those blood vessels, releasing the kind of anxiety about feeling anxious. And this can be really useful for our clients too, because often they see a stress response as something bad and we need to do something about it through medication or something else, or avoidance. And it doesn't have to be it doesn't have to be the case. How you think about stress matters. And when you think about it positively, your body will respond. Okay, so I've got questions or comments. We might be kind of over time, but I don't know whether there's any kind of floating around before we finish up.